welcome back to Ekse right here on Cape Town TV, the biggest, the baddest, and the most hip and happening show in the motherland. We're taking all the way up until 5 p.m. We're all about making sure you are entertained in Makaya. So to make sure you tell neighbor wago, you can contact us right now on social media at Ekse Live on Twitter and Facebook at Ekse on Cape Town TV. Also phone 021 448 Right about now, Khetha, which is doing amazing things for young people, all about empowering young people and of course teaching them how they can manage impilo zabo. We all know Mzansi has one of the most high stats when it comes to HIV and AIDS. And right about now, tell us more about Khetha is of course Pumeza, who is a patient support coordinator, and of course the incredible Amangile, who is a youth ambassador for Doctors Without Borders.
Absolutely.
Guys, welcome on the show.
Thank you.
It's a pleasure having you. You know, every time we talk about HIV and AIDS, it's not a topic that in the townships or everywhere across the globe that people feel
Freely to talk about, yeah.
Even though it has been in existence for numerous years. Let's talk about Ekse as a platform. Where does this idea, incredible idea by the way, where does it come from?
Okay, so because we looked at the problems that the young people are facing, and most of those is that we need information that is based mainly for young people, right? So an app was like a great way to go about it, because we know we are in the fourth industrial revolution, and young people, when you give them information, they're more likely they want into a relevant to them, something that is interesting, something that is fun. So an app is like a way to do that. So Avaro and MSF then started this application through them, working with young people like myself to like help with the development of the app.
Yeah, Pumeza, I understand that Khetha works in 2 different ways. What are those ways and how different are they?
So Khetha, on this app we have videos, and these videos are created by young people, as Amangile has mentioned, and we have questions and answers there. We also have an HIV test. That's a nice one, where a young person can just go online and you do your HIV testing, but obviously then you won't be doing like the testing.
Sure.
But it takes you through the pre-test counseling.
Okay.
The time that you are going to go to a counselor and have all these questions, but you can sit on your waiting area and then you just go through your pre-test, so that when you go to the counselor, you already have information about what you're going to be doing inside. And the only thing you just do, you continue with the testing. If you have extra questions for the counselor, then you continue to ask your questions to the counselor. Then the videos, they are made for you. It's things that young people relate to.
That is so awesome. Just the app alone, having it in your hand, because sometimes, like Sinala actually said, when it comes to the HIV topic, it's not a conversation that's likely have. And I want to know from you, the number, 39% of the new HIV infections is among our youth. Why do you guys think that is? Is it because the youth is being irresponsible? Is it because we don't have enough knowledge about HIV and AIDS? And also I'm reading that people are also feeling intimidated actually when going to clinics or hospitals to actually inquire about their status and things like that.
Okay, so you mentioned the first problem is that people are feeling intimidated, because as much as information is there, like it's not specific to young people. And you know, everything that is for youth. So like the fact that you can't, like they can't even ask questions to like counselors or whatever, and also then that makes them not being comfortable to even go to the clinic, right? So if there's an app that is able to do all of that, because they don't like asking questions, or if you ask questions about HIV, you look like the weird person or whatever. So like there's that stigma. So we're trying to remove that stigma by using this app to open up conversations amongst young people and making young people to know, okay, there is something like Khetha that is there for you, that can help you, support you through each journey as a young people to choose to be healthy.
How do we change the stigma among young people? Because you said 39%, that's a huge number. How do we change the stigma?
So we change that stigma by including young people in problems that affect them. We include young people in being actively involved in having solutions to their problems. Because if older people come up with these solutions to problems, abantu abana 18, 24 years old, those solutions are most probably not going to be relevant to them, and they're not even going to like use those solutions. So we actively involve young people into solving this problem and making sure that it is with what they want and what they need, and not what like other people want and need.
Pumeza, how long has Khetha been in existence, and how has their users said about it? Irresponsible, injured.
So currently, Khetha will say we pilot stage.
Okay.
So we started out of this last year, where we included young people and then they talked. So I think one thing that I need to mention was the fact that when we spoke about Khetha, we didn't only speak to young people who are HIV negative. It was a mixture of people living with HIV and those who don't have HIV. So these were collective resources coming from different people. So I think that's the other thing nice about Khetha, because everyone was involved in making sure that we do have Khetha. So we started piloting this at Site B Youth Clinic, where we know that young people, they go to. And the response currently, it's good. We see young people, they go to the clinic with their phones. So instead of them having someone who's standing there teaching them about something, they just on their phones. So what we would do, we tell them about the app, and then they just go to the app. And when they go to counselors, the counselors themselves have mentioned that now they have learned a lot actually from Khetha, because young people, they go to them and ask them questions. So now it's about me as a client who asks you a question, instead of me as a practitioner asking you a question. So that's what we want. We're saying nothing about young people without young people.
Pumeza, I want to know from you, when it comes to the app in itself, when it comes to requirements of using the app, things like that, where do I download it first of all? Do I need to have, let's say, data per se on my phone? Is there offline programs that I can use? And do I need to be HIV and AIDS positive per se? Or can I just, a normal person like me, go on there just to educate myself on the app as well? What are some of the benefits that's on there?
Yeah. So Khetha works for an HIV negative person. For an HIV positive person, it works because you get to see the videos, get the information. You know, young people, they also have assignments at school that when they go to Khetha, they can also get those questions and answers from. And then an HIV negative person, it's like a journey of we walk with you within Khetha. And in order for you to get into there, you don't need to have data. It's a data-free thing. Because we know that young people, they don't have money for data. So it's a data-free. You just go on your Google or your Chrome. You just say www.mykhetha.co.za, and then the app will be open. Or you go to aviro.mykhetha.com, and then at Facebook we also have the youth Khetha youth at Facebook. YouTube, the videos are there as well. Yeah, so you don't need to. But then the age, if you're younger than 12 years, then you're unable to go to Khetha. And then if you're older than 24, then still you cannot go to Khetha.
Now I want to know why.
Because when you register, you have to put in your age. Yeah, because we catered for the young people. We've seen the high rate of HIV, where it goes to. So we want to take them there now, the ones that we see that they are at risk of contracting HIV. So with them, then you have to be.
Yeah, I know everything nowadays is actually online, but not everyone has the pleasure and the honor of owning a cell phone. Actually has internet stuff. There may be other programs outside Khetha that actually works with young people, educating them and informing them more about HIV and AIDS.
Yes, so one with Khetha, you can use Khetha even if you're at home, right? You can take your mother's phone and register with your mother's phone number, then you're able to go to Khetha. But then the youth clinics, we're still there, we're still available. Information is still taken out. There's still organizations as well, like Soul City, the Rise Youth. So they talk about HIV, grassroots soccer. They also talk about HIV. So if you go to their spaces, so this Khetha will help you if you are unable to go to these spaces and you want to take care of yourself, then you just sit at home
Yes.
and then you go to Khetha and you learn more about HIV and how, like using a condom and all that.
Khetha is such a beautiful initiative. Ndiyazibani kwi-stages zokuqala, like it's
Yeah.
been a year pilot and yeah exists at KZN as well as the Western Province. However, HIV epidemic, unfortunately, the whole country is suffering. Are you planning to expand to other provinces? The other 7 that we did not count.
Okay, so the fact that Khetha is in like 3 languages, which is you've mentioned that it's Xhosa, Zulu, and English, it shows Bana we want to expand not only to young people of Ekhayelitsha or Igugulethu or like just in Cape Town. The fact that it's currently now in Cape Town and KZN, we want to like expand, but because in the say Kalamos like there's
It has to start
Yeah,
somewhere.
you have to first test how are people going to react to whatever you're giving to them
Yeah.
before you actually give it to the rest of the country, because HIV does not only affect Khayelitsha and KZN people, it affects everyone in the world, no matter who you are. Yeah.
I love that. Amangile, I want to know from you, and I need you to leave us with this piece of information, why it actually is so important for us young people to educate ourselves when it comes around HIV and AIDS, and also making this topic or conversation more regular and more comfortable among us.
Okay. It is important for us young people to educate ourselves about sexual health because it affects us the most. Like, let's be realistic, like about that. It really does. And if we don't educate ourselves about that, we end up people get misinformed, or like people don't go testing because of stigmas, or people don't get the support that they're supposed to get because someone is HIV positive. We need to like support each other, and we need to like learn is accurate and not like tell each other myths or whatever, because we're scaring people from actually going to test. Because like when you talk about sexual health, it does not necessarily mean you are HIV positive, or even if you are, that's not wrong. We need to tell people it is okay whether you're HIV positive or HIV negative. We need to be there for each other as young people.
You know that we just celebrated the World AIDS Day, but it doesn't mean bahlala ngalamini cha. Educate about yourself every day. We'll be right back right here in Ekse.